All right. Hello, everybody. Hello, Virginia. It is 4 o'clock on Monday. I know it's been a week, but this is the time we get together, get an update on the war of our times against COVID-19. And remember, we're going to get through this. We're going to get through this together. The world's going to look a lot different this summer, and that's a really exciting thing. Let's start with some other good news from around the Commonwealth. Late last week, we announced a pair of great economic development projects that together will bring over 800 well-paying jobs to our Commonwealth. First, I'd like to welcome House Foods America Corporation to Kentucky. The company is locating in Louisville's Riverport Authority's Phase 5 development with a $146.3 million investment. More importantly, the company is creating 109 quality jobs for our residents at an hourly wage of nearly $27, including benefits. That's $27 an hour, including benefits. These positions will include machine operators and production staff. They'll include engineers and R&D, logistics, and administrative workers. House Foods produces tofu using 100% U.S.-grown, non-GMO soybeans, as well as other food products for the American market. Its parent company, Japan-based House Foods Group, has operated for more than a century, offering a variety of products over the years. I am proud that this company is locating in our Commonwealth as its leaders look to reach more customers across the United States. Work on the project's expected to begin next year and to be completed by 2025. The addition of House Foods adds to Kentucky's strong and diverse agritech and food and beverage sector, which includes over 350 facilities, employing more than 52,000 people in our state. Expanding Kentucky's base of agritech-related businesses is at the forefront of how we plan to build a better Kentucky, how we are recruiting the jobs of tomorrow, not chasing the jobs of yesterday. And House Foods will greatly contribute to that effort for years to come. The company also strengthens the presence of Japanese employers in Kentucky. Currently, nearly 200 Japanese-owned manufacturing, service, and technology facilities operate in the Commonwealth, and they employ about 47,000 people. Thank you, House Foods, for selecting Kentucky for this substantial project, and thank you to everyone that worked to make it happen, our local leaders, our state leaders. This is a great investment. I can't wait to see all of the contributions to the community that House Foods is going to make. Welcome to Team Kentucky. Next, we have an existing Kentucky company that has shown significant growth and is expanding its footprint in our state. Kentuckiana Curb Company, known as KCC Manufacturing, plans to create an incredible 700 new jobs at an hourly wage of $29, including benefits, with the new location in Simpsonville. 700 new jobs. The new $60 million 380,000 square foot facility on Buck Creek Road in Shelby County will provide the company with much needed space to meet substantial recent growth. KCC currently employs more than 500 people at two facilities in Jeffersontown, where it manufactures HVAC equipment as well as roof curbs, curb adapters, and other sheet metal products for roof-mounted air conditioning equipment. So think about that. 500, adding another 700. That's how much this company believes in Kentucky. KCC serves a wide range of industries, from agritech-related businesses and restaurants to healthcare facilities and even school districts. After the challenges of this past year, we know more than ever the importance of systems and technology that promote the highest air quality, and KCC is leading the charge in keeping us safe. Work on the new location is scheduled to begin at the start of 2022, with construction expected to be completed in 1 year. To everyone at KCC Manufacturing, thank you so much. This is hugely exciting. The people of Shelby County, the surrounding area, and all of Kentucky. You've been a strong employer in the greater Louisville region for more than 40 years, and this is an amazing expansion. And congratulations to Shelby County and everybody who worked on this. This is going to benefit so many families. These two announcements are great news for Kentucky, and folks, they are just the start. I believe our economy is supercharged primed to take off in these next 14 months. So while the last 14 have been hard, expect big and great things in the coming year plus. All right, next, FEMA individual assistance update. As you know, this past winter's weather took a toll on a great number of Kentucky households. But 10 days ago, the president granted my request for a major disaster declaration for several of our counties. Included in that declaration is individual and household assistance from the Federal Emergency Management Agency for residents of 9 counties: Breathitt, Clay, Estill, Floyd, Johnson, Lee, Magoffin, Martin, and Powell. The types of things covered include temporary housing, home repairs, medical or dental expenses related to the disaster. Residents and business owners who sustained flood-related losses in these 9 counties should apply for assistance with FEMA by registering online at www.disasterassistance.gov or by calling 800-621-FEMA. Last week, we asked FEMA to conduct damage assessments in 26 additional counties that also reported significant damages to residents. They are Anderson, Bell, Boyd, Callaway, Clark, Fayette, Franklin, Greenup, Jackson, Jessamine, Knott, Laurel, Lawrence, Leslie, Letcher, Lincoln, Madison, Mercer, Morgan, Owsley, Perry, Pulaski, Rockcastle, Todd, Warren, and Woodford. The assessment is likely to take several weeks, after which FEMA will make a recommendation. It'll ultimately be up to the federal government. Right now, though, only residents in the 9 counties can apply. We will keep you updated as things progress. The next one is both tough and special. So we've taken the time over the last 14 months to honor Kentuckians that have died of COVID-19. And we're going to do a remembrance now that isn't related to the virus, but it is important to share as the Commonwealth has lost one of our very, very best. Ernie West, a humble son of the town of Russell, fought in the Korean War and earned the Medal of Honor for his valorous actions rescuing wounded comrades while under enemy fire. Ernie has been a good and valued friend of the Kentucky Department of Veterans Affairs for its entire existence. We have always been able to count on him to grace our ceremonies and special events. For more than a decade, Ernie was a tireless advocate for building a state veterans cemetery in his home county of Greenup. He worked with state legislators and local officials to secure the land and the state match funding for construction. And he was there on October 1st, 2010 for the dedication of the Kentucky Veterans Cemetery Northeast. He made it happen. While our state leaders and dignitaries were in attendance, the star of the show was Ernie West. However, in his true form, Ernie remained quiet, unassuming, and modest. Ernie told the Ashland Daily Independent that at first he refused the Medal of Honor. Think about that. He said he thought everyone deserved a medal. He accepted the medal from President Eisenhower, but always responded to comments about his courage with, "I did what any of us would have done. They were my brothers. I had to rescue my brothers." Ernie West, rest in peace. Thank you for your amazing contributions. Thank you for the example that you have set. Thank you for showing the world the greatness that we Kentuckians aspire to. We will miss you. All right, let's move into our COVID update. Let's first look back on this last week. Let's start with our stair-stepper chart, which is going to show you that we are indeed and have been for weeks in a plateau. We certainly stopped the downward trend, which we'd want to see continue. But at different times, we thought we might have started an escalation. It's pretty clear now that that is not the case, and that what we have seen and what we expect to see, unless the data begins to change, is going up a little bit, going down a little bit. So this last week was up on the week before, but down on the week before that, up on the week before that, down on the week before that. So again, a plateau isn't a straight line across. You go up a little and you come down a little, and that's what we've seen in cases. It's also what we're seeing in our test positivity, because again, we were up this last week on the week before, but down compared to the week before that. We had concerns a couple weeks ago that we were maybe seeing our positivity rate increase at a small but real rate. Now it does look like we've plateaued, but it is certainly something that we want to watch. We also see plateaus in our inpatient census. It might have creeped up a little, but nothing appreciable that would threaten our healthcare system. The same on the ICU census. And the same with our COVID-19 patients on a ventilator. Again, you don't see a flat line across, but what you see is an average that would get you pretty close to that. Hospital capacity by region, we're seeing the same thing we've seen now for many, many weeks. Only one area in the red. Actually, as I look at this, it's better than it's been, even in that region, in a number of weeks. So we feel very good about our hospital capacity. And I will say that I hope that every Kentuckian takes pride that we are one of the only states in the country that never had a serious hospital capacity issue, that never got to the point where statewide our hospitals were reaching capacity, having to turn people away. Nothing like that happened here. And because of that, more people are alive here per capita than just about any other place. That is all of you all being willing to sacrifice and do what it takes that's made that happen to date. But if you wonder if this virus is over, just look at what's happening in India, where not only are the hospitals overwhelmed, but in some cases they can't accept people unless they bring their own oxygen, where they're using thermal imaging to try to determine a death toll. It is staggering. And it ought to remind us that there is still much work to be done and how deadly this virus can still be. The way that we ensure that nothing like that ever happens here is we get people vaccinated. So today, we're taking a couple of steps, and Dr. Stack will talk after this about we're moving from the state data system that we had been using to the federal system. That means our numbers will line up with the CDC's numbers, and that's what every other state was using as their benchmarks. We were the last using just our state collected vaccination numbers. What that means is, can you put up table 1? That today we are showing 1,833,652 Kentuckians having been vaccinated. Now, this is actually the number of vaccinations the CDC has us having done in Kentucky. I think I'm going to be able to give us an even more accurate number of Kentuckians vaccinated in a second by talking about the number of Kentuckians vaccinated out of state, but also the amount of that overall number, which are people from out of state vaccinated in Kentucky. But this will be the new chart as we're using it, so that we are in line with all 50 other states. It's also shows some really exciting progress that we have been making, even with vaccinations slowing down a little bit. We're also going to be showing on our daily report, and there'll be a dashboard too, vaccination percentage by county. So if we could put up tables 3A and 3B, this shows, and you'll be able to see all of it, both our top 5 and our bottom 5 counties by vaccination. To our top 5 counties, good job, keep it up. There is still so much more to do. To our bottom 5 counties, just let's work harder. We want everybody to be protected out there. And let me say, the local health departments in these areas are working hard. For instance, the Christian County Local Health Department has vaccinated a ton of people. It just turns out that most of those people are from outside of the county. But you know, if you see your county listed here, it means that it's going to be less safe than other counties. So I would hope that we could redouble efforts to get everybody out and vaccinated. I would like to see some healthy competition amongst our counties. If we look at the top 5 over there, there's just 3% separating Woodford, Franklin, and Fayette counties. And I know everybody wants to have the largest percentage of people vaccinated because it means that your counties are amongst the safest. We put up table 5 too. This is helpful. Now we have to move some of what we've been tracking to the federal system. We had been tracking 70 and up in the percentage. They track 65 and up. And this is a really exciting number that we've reached. 79% of Kentuckians, 65 and up, have now had at least one dose of their vaccine. These are the people most at risk, and that is a blessing, folks. That means that we have worked really hard. That means you have worked really hard to get people to get vaccinated. If you're in this age group, thank you. Thank you for getting out there and taking advantage of these miraculous vaccines. 50 to 64 years old, 57%, better than certainly the overall state, but we need to do more. And then as we see really 18 to 49, we could do better. Total population 16 and up, that's who is eligible, 52% vaccinated. And actually, we think we see a really good response of 16 and 17-year-olds, and that's really exciting. It suggests that when we're able to move to younger Kentuckians, that we can get a large percent vaccinated. And my goodness, what that means for the next school year is really, really exciting. Okay, so I told you that I think I can give, and again, we're adjusting to these new data systems, an even better number than the 1,833,652, which is shown as the number of unique persons vaccinated in Kentucky by the CDC. So what we also know is we've had 92,991 Kentuckians vaccinated out of state. But in that 1,833,652 number that we showed you on the table, 78,368 are people from outside Kentucky that we've vaccinated inside Kentucky. So what that means is when you remove those Kentucky, the out-of-staters, and you add the in-staters that were vaccinated somewhere else, we have an additional 14,623 Kentuckians, which brings the overall Kentucky number up. I'm sorry, we have an addition of 14,623. We believe with the extra, the out-of-state and the in-state extra numbers, that we're really at about 1,848,275 Kentuckians vaccinated. For our goal, that leaves 651,725 more people that we would love to get vaccinated because of how safe that'll make our Commonwealth. Now, I continue to see some articles or some others out there talking about that goal. I've now answered questions about 7 times saying we are open to relaxing certain restrictions before then, and indeed we have. We were able to relax travel guidance to those that are vaccinated. We were able already to increase indoor capacity to 60% for things like restaurants and retail and others. We were able to increase capacity for stadiums and arenas, outside and indoor. We were able to relax our mask mandate. So we are taking steps, and in many ways taking them faster than other places. And we're going to consider what we can do moving forward every day that more people get vaccinated. And if you want to hit that goal faster, following places have a lot of openings. U of L Cardinal Stadium could take 4,000 people tomorrow. Think about how fast we could hit our goals. Owensboro Regional Health Hospital could take 900 extra people a day. St. Clair in Morgan County, 700 extra available right now. In Ohio County, 600 extra from Ohio County Healthcare. And the Medical Center at Bowling Green can do 500 plus more than what it is seeing right now. All right, to talk about this transfer over to the federal system so that we match what every other state is doing, as well as what the federal government shows, and also show a new dashboard that we're going to have up that provides a lot more information on vaccinations. We have Dr. Stack.
Good afternoon, everyone, and thank you, Governor. It's nice to see you. So I have a few things I want to talk about. The first thing, there's no slide. We're going to change starting tomorrow. For those of you who look at this, maybe the reporters the most, on the website we have the total number of tests performed. We break it down by PCR tests, serology tests, and antigen tests. Over the course of this journey, this 14-month journey with COVID, we had to build an entire new system for testing, specifically for COVID. We had to build data systems to capture the information. We had labs that were not traditional labs. So we had providers who started providing services in Kentucky that maybe didn't before the pandemic. We also had clinicians who provided testing who maybe weren't traditional labs, but they provided point of care testing and had to report that to the state. We had to have multiple systems built from scratch in order to do this. We have worked methodically over the last year to do as much electronic reporting as we can, and we've had a fantastic journey here, and thank you to all the lab service providers who've worked with us on this, and a hat tip to the IT professionals and public health here at the state level who worked very diligently to do this. It's a lot of work. In April of 2020, we only had about 34 laboratories reporting electronically their data to the state for the COVID testing. May 2021, we have about 617 labs. That's an over 18-fold increase. And we still have over 1,000 labs in total who have reported testing results of some sort over the last 14 months. I mean, that's a staggering amount of data we've had to handle. So as we do this now, we need to harmonize the data so it's rational going forward. So tomorrow, there's going to be an increase in some of the tests, the PCR testing, I think the antigen testing. Those numbers are going to be increased as we take these different data sets we have and combine them into one. And when we do that, we are now going to use the electronic laboratory reporting data going forward to add to all three of those types of tests. So there'll be a one-time adjustment tomorrow. Those numbers will show up on the website. And going forward, we will entirely use the electronic lab reporting system, which is what most states are doing now, I think, to add to the future test numbers. James, if you could put up my slide number 1. The governor talked about our transition to federal data. So the federal Tiberius data system is the data system from which the CDC pulls to populate its dashboard online. It's the database that every state and territory is using to enter data and to pull data out to track our utilization of vaccine, the number of people we vaccinated, where they've been vaccinated. This is a sprawling database, and it is growing and improving consistently throughout this journey. And so this is now making it possible for us to transition to federal data and to create the dashboard that you can see on your screen here. This dashboard should be live now. If it will be live this hour for sure. If you go on the KY COVID-19 website and go on the vaccine tab, you'll be able to click a link to get to this dashboard. In the top left, you'll see the total number of people in our state, and then the percent of vaccination broken down by total population, population 18 or older, and population 65 or older. I'm going to observe, even though we pull from the federal data set, because the algorithms are different, because the methodologies are different, we can't get our numbers to exactly match what's on the website. And that just happens. One thing I've learned over the last 14 months is just how complicated getting all this data harmonized is. That being said, it's a lot closer. And what it will enable us to do is to populate that county level dashboard. And if you hover over any of those counties, it'll do a pop-up box. And I pasted in there an example of it for Woodford County, which is the highest vaccination rate in the state. And you'll see it shows the county's population. We use 2018 census data because that's what the federal government uses for its CDC COVID tracker website. And we will show you then the percent of their total population, population 18 or older, and population 65 and older vaccinated. So now you can look at this dashboard, which will be updated daily, and see how your county is doing relative to other counties. Now remember, herd immunity, we talk about the lowest number mentioned is 70%. So we're not near that anywhere. The closest is in Woodford County, but we really need to work to get this up as high as we can. This is how we all get back to business, to play, to travel, to social activities, all the things that we want to do. and miss. Of course, in the bottom, there are bar graphs that will be updated as the data changes that show the top 5 counties' highest vaccination rates and the bottom 5. And on the right-hand side, there are age report outs for the amount of that age bracket that we vaccinated. This does not include race and ethnicity data because the federal data system and the state data systems report this differently. Right now, the state is still more precise than the federal. And so we're going to use the state data in order to provide more precision until the federal system continues to improve, and we can use that for everything. If you could show the next slide, please, James. So this is a bit crowded, but I just want to draw a few points here. So this is a tool that the federal government started releasing, I think, last week. This is a key performance indicator for all the states and territories that's in the Tiberius data system. They take 4 different criteria. One of them is our ordering, another is our inventory, another is our administration, and the 4th one is our equity. What they do is they have a methodology for each of these, and they assign a score for each one out of a total of 1,000. They add the scores up and they divide by 4, and that gets the state score. This was run today for us, so this is through May 3rd, which means the data is probably current through yesterday, May 2nd. Kentucky scores in the bottom right, it's 702. That is compared with our region, and our region includes Kentucky, Tennessee, North Carolina, South Carolina, Georgia, Alabama, Mississippi, and Florida. And I'm sorry if that's Virginia signing underneath my picture there. I did that so fast, I apologize. So our score is 702. In the region, it's 348. We are substantially better than our region. And nationally, the score is 403. We are way better than the nation as well. And when you look at a low score like a 111, when you actually look at the details for that, the score that our region gets on that report is a 0. And the score that the nation gets is a 30. So our 111 by relative comparison is actually still pretty good compared to the rest of our region and our nation. So I show you this because even while the vaccination rate has slowed down, Kentucky continues to perform very well compared to our region and the nation. And James, the last slide, please. So here is from today a screenshot from the CDC COVID tracker. And on this, you can see that for every state south of us, all the way from Texas to Florida, Kentucky is doing better. For every state south of us. Now, Florida is the one outlier, and that's because for their population 65 and older, and Florida has a higher proportion of people 65 and older, their vaccination rate is almost 85%, whereas ours is almost 81%. So we're still doing very well, but for every state, and Florida had a bump up here more recently, we were doing better than all to the south. And for our 7 contiguous states, we are outperforming 5 of those 7, Illinois and Virginia being the exceptions to that. So I'm really proud of the work people have done throughout the state and across the state. Thank you to the health departments, the hospitals, the pharmacies, and the other offices. My final comments here tonight are just to encourage us. You know, getting vaccinated is an important choice, and it is a choice. It's a choice each one of us makes to help protect ourselves, to protect our families, and to protect our communities. In countries like India and Brazil, they're getting absolutely hammered right now by this virus. And we've already talked about this, but thousands and thousands of people throughout those countries dying every day. And death rates we really are even uncertain about in India because they're so high. So that misery allows opportunity for the virus to mutate in great numbers. Mutations, if they happen enough and with some success, can undermine the effectiveness of the vaccine. The best way to minimize that is to get vaccinated quickly, minimize the propagation of the virus, and put this whole thing behind us. In the United States of America, we are one of the few countries that if we were all to roll up our sleeves and take that shot, we could all be vaccinated by the end of June. There is enough vaccine in the supply line and enough in the field that we could vaccinate every Kentuckian who's eligible, certainly over the next couple months. Right now, today, I bet we have close to 900,000 doses of vaccine in the state. And if you figure most of those are 2 doses, that means we could vaccinate over 400,000 people over the next 2 or 3 weeks if people just showed up and made appointments. So I want to encourage everyone to get informed, to talk to your doctors, your primary care providers, the people you trust for your medical care, seek their counsel, address your concerns. And I do hope that you'll find it in you to determine that this is a good thing to do for yourself and for all the people we all care about. So thank you very much. And back to you, Governor.
All right, today's COVID numbers, which we may have sent out electronically just a few minutes ago, 313 new cases of COVID-19. Positivity rate, 3.45%. Kentuckians hospitalized due to COVID, 414. In the ICU, 102. On a ventilator, 47. Now we got one new number that we're calculating, again, to show how new cases are skewing younger, and that's the incident rate. And we have an incident rate of people who are 50 years and older. That is 8.03, but 0 to 49 years, in other words, younger than 50, is 13.41. In other words, it's more than the incident rate is 1.5 times, a little bit more than that, higher for those under 50 than over 50. So we need you to get vaccinated, especially if you're in your 20s or 30s. We really need you to get vaccinated. We're also reporting 8 total deaths today, 5 that have come up through the local health departments, 3 through our continuing audit. The 5 through the local health department, including an 84-year-old woman from Fayette County. That's a March death. That's a long-term care death, too. A 65-year-old woman from Harrison County. That's a January death. 78-year-old man from Hart County. That's a March death. 93-year-old man from Henderson. That's a March death. And a 94-year-old man from Nelson. That is February. Of our audit, a 70-year-old man from Boone. That's from January. An 80-year-old woman from Lawrence. That is a January. And a 77-year-old woman from Washington County. That is a November. Another great reason and need to get vaccinated is the variants of concern identified in Kentucky continue to increase. Of the 5 identified variants of concern, we have at least 407 cases thus far in Kentucky. We know it's a lot more than that. 381 of them are the B117, the UK variant, by far the dominant variant that we have seen here, and also likely now the dominant variant throughout Kentucky, like it is throughout the country. Long-term care update. We're starting to maybe see this trending up, and it's of concern. We have 8 new residents testing positive. We have 16 new staff members testing positive, and we have 8 additional deaths. They're not all new. Some are coming from the audit. We're watching this very closely, and we've got the ability through the changes we made earlier in long-term care. When a facility is once again headed in the wrong direction, we have the opportunity to step in and add some additional steps or restrictions if necessary to protect those residents. We cannot let these numbers go up. Far too many have died in these facilities. We want people to have the visitation they haven't had in so long, but we need to see some improvement based on the increase in cases that we're seeing. All right, with that, we've got a number of journalists on the line today. We're going to open it up to their questions. We will start with Chad Hedrick from WKYT.
Governor, today the New York Times posted this article quoting health leaders saying that it's unlikely that the country will reach herd immunity levels. So how do you think this affects Kentucky and reaching that goal? Surely enough, we got the news that we're a bit closer to that today. And then also after New York announced dates for reopening things and expiring some of their restrictions, as these other blue states, I guess you could call them, are announcing some dates and things, is there a little pressure to kind of do that here?
So I don't look at this as being a red state or a blue state thing. This is a life and death thing. So if you read the nuance of what New York is doing, much of their reopening plan is getting to the place that we are already at. I think that they're going to open up stadiums and arenas at about half of where we are right now in mid-May, and those dates that people announce are always going to be subject to change depending on where the virus is. You see a lot of other states that are adapting to our approach, that know how safe you are is based on the number of people vaccinated. But let me say it again, I think this is about the 8th time. We are willing to loosen these as we go before we hit the 2.5, as things get, as we have more and more people vaccinated, and as we get more and more of the science coming in. The states that are supposedly talking about a date to loosen haven't done anything that we've done over the last month, increasing our capacity for indoor activities such as restaurants and retail, which we did, loosening our guidance on travel. One of the first states to relax its mask mandate for outdoor events. And we just held the largest sporting event since COVID. So I think Kentucky is doing a whole lot. We are going to eventually hit that 2.5 million goal, but we'll be able to do some things before then. As far as reaching herd immunity, this is part of the debate that goes on that seems to change week to week. I believe that we will reach it. We'll reach it because a certain amount of people will get vaccinated and a certain amount of people will get the virus. And hopefully most of those people survive, but they'll get some level of natural immunity. To me, I want a whole lot of people to get vaccinated and have immunity. And I would like for fewer to actually have to go through the virus to get there. What we're trying to make sure is that more of us are around. But look at the science, look at the ability to create a booster if necessary. We're going to be okay, but there's no reason not to get to that herd immunity. We just got to get people vaccinated. Tom Latek from Kentucky Today.
Good afternoon, Governor. I've got two for you, since I guess this is your only press conference this week on this. So the first one is kind of a quick one. The second one, not so much. The quick one is, why is the positivity rate so important? I get to ask that a whole bunch. And then secondly, testing. You mentioned testing. I asked you about it a couple weeks ago, and you said you still get tested every 3 weeks. I started looking for testing locations, and the first 4 that I found close to me had testing dates in August and September of last year. And then I went to the one at Kroger Field to look at see what they had available. And when it said get directions, I said, okay, we'll see what they say. It sent me to Detroit. So is there an issue with the website that needs to be looked at?
We'll check on that. There's certainly still plenty of places that you can get tested. We'll check on the website. We don't want you to have to head to Detroit to get it. Positivity rate is important because it tells you 2 things. Number one, the sufficiency of the testing. But number 2, it tells you how much the virus is picking up, is increasing. It is a leading indicator. In other words, your positivity rate will start going up faster than your number of cases will go up. So it gives you maybe a snapshot into the intensity of the spread of the virus and what we have seen when we look at when we've lost people. This is now the 3rd leading cause of death in the United States, if that's not incredible. What it shows you is when we have our great increases is also when we lose the most people. And so it gives us an idea of the trend before we start seeing it manifest in cases. It gives us an indicator of when we would become concerned about the hospital capacity. Just an idea about how much COVID is out there in the community when we know we're not testing everyone and we know we're not finding it in everyone. So it's another piece of data, just like the case numbers, that give us a better picture. Karen Czar from WUKY.
Good afternoon, Governor. Hello, Virginia. Governor, there were very few people wearing masks at the Kentucky Derby. If we don't see a spike in cases in the next few weeks, will that play a role in any decisions regarding masks at large events? If the numbers do go up, how will you work with venues towards enforcement? And then one other, if you have time, are we reducing the amount of supply we're requesting as fewer people are getting vaccinated? Thank you so much.
So first, let me say we were proud as a Commonwealth to be able to host the Kentucky Derby, even in the midst of a pandemic. It was good that it was able to return to the first Saturday in May, and I think it showed the rest of the nation a lot of hope. I certainly know a lot of people that tuned in from out of Kentucky that could feel that a return to normalcy is on the horizon. Certainly, capacity was significantly restricted. All throughout Churchill Downs. It was primarily outside, which is a good thing. Now, we didn't have as many people wearing masks as they should, and that's something that we will have to improve on in the future, though I do think a large percentage of people that were there were vaccinated, which again would be a good thing. We'll watch carefully in what we see afterwards. Certainly, we are learning more and more about outdoor events. That's why we have lifted the mask mandate for outdoor events under 1,000 people. We may, in the future, potentially be able to relax that further. One of the challenges is when you go from outdoors at a big event to inside, maybe to get concessions, there can still be a lot of people in an indoor environment. So we'll watch everything that comes out of it. But I think the world was able to take a breath, knowing there's still have a lot to go to fight and defeat this virus. But there are things that we have loved doing that we can get back to doing right on the horizon. Danielle Grady from Leo Weekly.
Hi, Governor. A recent report by the Root Cause Research Center in Louisville found that there have been 888 eviction judgments in which the tenant was found guilty in Louisville since the beginning of the year, and 2,260 eviction judgments in Jefferson County since the pandemic started, which is an untold fraction of the number of evictions occurring throughout the state. Activists and nonprofit groups have been calling on the state government to expand its eviction moratorium once again to include a hold on all evictions throughout the state. And still others have been calling for all rental payments and mortgages for landlords to be canceled. So in the face of these stark numbers from Louisville, would you consider taking either of those actions? Thank you.
Well, thank you. What we have right now is a robust assistance program that started with our $15 million Team Kentucky Eviction Relief Fund and is now a fund overall in Kentucky of about $240 million. Louisville and Lexington got separate direct allocations along with others. We still don't have enough people taking advantage of those programs, and we want to help everybody because I want everybody to be able to stay in their home and they can use that program to pay their rent. That gets them out of debt and out of concern. It also helps their landlord, which may or may not be a small business person, also working in the community. Now, at a time when we had an eviction moratorium, now our Supreme Court ruled that certain evictions, and this was through their regular order, this wasn't through a case, could continue. And so with that, we think that the court has spoken on at least the ability for the court system to hear those cases. So at this point, we believe that the moratorium that we have on that mirrors the federal one is what's available under law, and we're going to continue that. But please take advantage of the Eviction Relief Fund. I don't think anybody ought to be able to be kicked out on the street in the middle of COVID. I do know that there are a very small number of renters that may be taking advantage with the ability to pay and aren't. But I know that's a small percentage that we should be able to work out separately from those that are just struggling. If we can get them the information about the Eviction Relief Fund, I hope we can get a good result for everybody. Corinne Boyer from WEKU.
Hi, Governor. I'm wondering if anything has changed as far as the state tracking what is done with doses at the end of the day. As far as the mass vaccination sites, are they having to throw any away? And does the state plan on tracking those, if so?
We have just gotten the ability, I think, going back to track doses that were ultimately not usable. A lot of those can be, each vial will have, say, 10. And once you open a vial, you either have to give 10 out or anything in that vial you ultimately can't use. It's one of the reasons it's really hard to get it in primary care physicians' offices. We all hear about that, but you got to be able to see at least 10 patients that day that would want to get vaccinated. So I believe we have those numbers now. I don't have them in front of you, but we'll share them with you and anybody else. Certainly, as mass vaccination sites have increased, as we went from vaccinating 40,000 people in a week to vaccinating 180,000 people in a week, we have had doses that we haven't been able to get in people's arms. I think our numbers compare favorably with others, but we'll get those to you. Alex Akisto from the Herald Leader.
Hey, Governor, I have two quick ones. You mentioned today, and you said many times, that you are open to loosening certain restrictions before 2.5 million people are vaccinated. You've already done that, basically. What are some additional restrictions that you're considering relaxing, and when could that happen? Secondly, New Jersey is giving out free beer with COVID shots. In thinking of different ways to convince Kentuckians to get vaccinated, have you or would you consider issuing an executive order to allow distilleries and breweries to give out free alcohol for people to get their vaccine? Thanks.
So we've heard about some programs on free beer or the rest. Haven't fully thought through what's possible on that. Through an executive order. We're going to have at least 2 announcements coming out here, I think, in the next week about some major incentives. One, working through or incentives, whether people think they're major or not, but things that will hopefully encourage people to get vaccinated. One through the state, one through one of our major partners. I hope that we could announce those as early as Thursday, because I believe Thursday at 4 we are going to be doing an update this week. Alex's other question was, additional steps we may be able to take. We're looking at that. We may be able to increase capacity. Right now it's 60% more. As we get closer to that 2.5, we'll certainly look at that. Office-based businesses was another that we may be able to increase a little bit faster. That we haven't seen all that much spread in private gatherings. We're going to be able to look at doing a lot more there. And let me just say, people have set different dates. I believe that Kentucky will be competitive in what we will be able to loosen as quickly as any other state. I will say, I know that there are those that are traveling the state that this is just the newest thing they're criticizing. If those folks would spend just some of that time encouraging people to get vaccinated, it'd save lives. It'd save lives. I know it seems like the silly season has already started, but please, if you're traveling around, especially if you're a part of a demographic that may be hesitant, just spend some time encouraging people to get vaccinated. I don't care who the message comes from. I just want our people to be safe. And setting a random date doesn't make our people safe. Lots of people getting vaccinated makes them safe and everybody safe around them. Let's try to do the right thing for people. And that is certainly encouraging these safe and effective vaccines. Melissa Patrick, Kentucky Health News.
Hi, Governor. Just to follow up on Karen Czar's question about the vaccine orders, has the state cut back on the number of vaccine orders it is put in based on the fact that fewer people are getting vaccinated? And then that prompted a second question: is anyone as Kentuckians are asking to be able to get vaccinated at their primary care doctor's office, is there any discussion about getting these vaccines in a single dose vial?
So we've talked with the federal government about our desire to get a single dose vial. It actually appears they're going the other way. I think Pfizer's going to go from 10 doses to 15 doses. It would be incredibly helpful to get a single dose vial. That does not look like that's going to happen, at least in the short term. And separately, we have not cut our orders, right, Steve, from the federal government? Well, okay, so the sites will order through us what they need. Those will come down from the federal government. But given that's the case, we're not getting into every single one that's available to us with the, yeah. Yeah, so Karen, I think, I'm sorry, both to Karen and Melissa, your answer is yes. We are not bringing the full amount that's available to Kentucky into Kentucky because we don't have enough people that are willing to be vaccinated. We make sure that we match everybody's orders with what they can do, and they still have extra on hand. Now that's there and available for us at any time. Joe Ragusa from Spectrum.
Hi, Governor. So I want to go back to the Kentucky Derby and specifically kind of the issue with the fact that a lot of people just weren't masked out there. At least anecdotally, talking to some of those people, it sounds like there's at least some, people are kind of exhausted by some of the mandates, especially, if they are vaccinated. Sure. What do you tell people who are vaccinated, who are kind of exhausted with some of these restrictions, mostly the mask mandate, but also some of the business restrictions and that sort of thing? What do you tell them, when they've pretty much done all they could and now it's, waiting on the holdouts who haven't gotten vaccinated yet or don't even plan to get vaccinated at all?
Well, you can understand the emotions of everything that people have been through, and folks that have stepped up and gotten vaccinated want to go back to living their lives. And a lot of the science suggests that that's safer than we originally thought it would be. We're really close, is what I tell them. I actually ran into a woman in Henderson, stopping and getting something to eat, I think at the Sidewalk Cafe. And she looked at me and she said, "How much longer do I need to wear this?" And I looked at her and I said, it's been a long time, hasn't it? She said, "Yes." And I said, "Just a little longer. We're just trying to get, more than a few, but a few more people vaccinated to where we reach the point where we believe we can take care of everybody that's not vaccinated if and when they get the virus. And knowing that we're not to the nose yet, we're to the casuals. We can get through parts of folks that have been casual about it, but still plan on getting it. We just got to make it more available. Then we'll get to the place that we need to be. And so what I tell them is just give us a little more time. We've done so much to protect those around us. We just need a little bit longer to get there. And we are really, really close. And we're all tired. I get that. We're all tired. But now, a lot more that we can do. Outdoor events, more indoor dining, more indoor retail. We've been making it happen despite the fact that it's not 100%. And again, we're gonna work on loosening as we go. But let's work really hard, especially over the coming weeks, to get where we get through school. That ends at the end of the month. We also kids back to school. Certainly some school number of kids and teachers quarantined here in every district in person. Catherine Collins, last question, Debbie.
I wondered, hi, Governor, if you could explain the shift, why we're doing it, and if it's standard.
Well, so the CDC and what is included in it has, well, it tracked both first and second dose, and break it down and break it out. And so individuals in the start, and we certainly is what was key. And that's how we should measure our agreed with us and started breaking out the other to it over time, but the level of data they now have. is more robust than ours. There was a point where we had, I think, in many ways, better Kentucky-specific data, but as they have developed their system, which they significantly have done in the last 2.5 months and continue to, it became a better and better tool. And we hit a point where consistency, we think, is important, and how we compare ourselves to other states or having numbers that are similar to the federal government's. And our numbers got closer and closer, certainly when we took into account that they can, in different ways, account for out-of-state, in-state, and some of the rest. So the time we thought was right, and moving forward, we think that it's going to provide that dashboard that we looked at. We're able to do because it pulls down those numbers from the CDC. You know, there was a time when it was also tough to get all the labs and some of the vaccination sites and the rest to get their data in and through both. And we went through some IT issues with reporting back and forth. We think those are primarily resolved. So again, we think now is the time to switch. But again, doing it today, we wanted to make sure we were transparent about it. And we're going to try to figure out on those tables how to also provide the data of Kentuckians vaccinated out of state, out-of-staters that are included in Kentuckians' numbers, Kentucky's vaccination numbers, so we can get to our best count of Kentucky residents vaccinated, which we did today. All right, thank you, everybody. Please, if you haven't yet, get your vaccine. To those that are out there, make sure that people have good information. Let's not get caught up in the drama of people arguing with each other or Dr. Fauci or anything else. There is accurate scientific information out there. Talk to your doctor about it. Talk to someone who has been vaccinated about it. Talk to your minister or your faith leader. And talk to people about it if you haven't gotten it, and try to come to the very best decision. We're getting real close, Kentucky. Let's keep pushing. Thanks.